and welcome to www.healthcmi.com Acupuncture Continuing Education Online. Today, after today's webinar on pelvic inflammatory disease and the belt channel, you can go online and get your certificate of completion after taking the quiz. If you need to take the quiz again, go ahead and take it again. There's no extra charge. Again, this is for 2 CEUs, this course. And we'll be covering many aspects of biomedicine, Chinese medicine, herbal medicine. So again, welcome to www.healthcmi.com. Our course is Pelvic Inflammatory Disease and the Belt Channel. I look forward to working with you. We'll be taking a look at herbal medicine in detail. We'll be taking a look at single herbs, herbal formulas, and many aspects of Chinese medicine differential diagnosis. I'm Adam White, licensed acupuncturist with the Healthcare Medicine Institute, and I look forward to today's workshop with you. Again, don't forget to take your quiz after the webinar and get your certificate of completion for your CEU credit. HealthCMI features many courses, anytime courses you can take 24/7, and live webinars on schedules. So today we'll be featuring PID and Chinese medicine. There's a lot coming up, and we'll get to look at some nice pictures of the herbs too to help get a feeling for the course and everything we're doing here. Maybe a moment to set up. We'll get started in just a moment. Pelvic inflammatory disease, PID, is the inflammation of the female pelvic organs or connective tissues, usually caused by an infection. PID is often the result of an ascending intravaginal infection that involves either a single microorganism or it may be polymicrobial. Gonorrhea and chlamydia are the most common causes. However, many types of bacteria, viruses, and mycoplasms may be responsible. Less common causes in the clinic are tuberculosis, actinomycosis, which is a bacterial infection sometimes caused by the use of IUDs, schistosomiasis, a parasitic worm more common in developing nations lacking a poor source of clean water, leprosy, oxyuriasis, that is pinworms, and sarcoidosis, a very unusual and chronic illness characterized by bodily inflammation and nodules, which are clumps of tissue, granulomas, which are basically clusters of immune cells. But primarily, gonorrhea and chlamydia are major causes of PID, especially acute PID. Today, we'll take a look at many herbal formulas and individual herbs for the treatment of PID, including Baizhang Chao, Chungen Pi, Heng Tang, Chuan Lian Zi, Yan Hu So, Mudam Pi, Chi Xiao, Zhao Jiao Zi, and many others. We'll also take a look at Chinese medicine differential diagnostics, the relationship of the Dai Mai vessel to PID, and acupuncture points used for the treatment of both acute and chronic PID. PID encompasses several biomedically defined disorders, including cervicitis, that is cervical inflammation, endometritis, that is uterine inflammation, salpingitis, which is fallopian tube inflammation, oophoritis, which is ovarian inflammation, and inflammation or infection of either or both of the broad ligaments. These are the lateral ligaments composed of peritoneum passing from the sides of the uterus to the walls of the pelvis. So again, any type of infection or inflammation in the pelvic region. General symptoms are abdominal pain and vaginal discharge. Acute PID symptoms include lower abdominal pain, often with rebound pain, fever, cervical motion tenderness, lower abdominal tenderness upon palpation, copious leukorrhea, and nausea. Lab tests often show an elevated white blood cell count and neutrophil count. Abscesses may develop and are commonly treated with antibiotics or surgical procedures to drain or remove the affected areas. General peritonitis may occur due to the spread of exudate to the pelvic perineum. This may trigger nausea and vomiting. In severe cases, endotoxemia and shock may occur. Acute PID presenting with a palpable pelvic mass indicates a possible tubo-ovarian abscess, a TOA, or hydrosalpinx, the accumulation of serous fluid in the fallopian tube. Approximately 30% of cases with tubo-ovarian abscesses are afebrile and present with a normal white blood cell count, thereby making TOAs difficult to diagnose. Diagnosis for these complications using laparoscopy, an operation using a laparoscope, is widely considered definitive, and ultrasonography is also employed. Surgery is required in the case of a ruptured abscess to prevent septic shock. So a laparoscope is when they make an incision and actually put a camera into the pelvic cavity to take a look. Acute PID often mimics acute appendicitis and ectopic pregnancies. An ectopic pregnancy is differentiated by a positive pregnancy test, irregular vaginal bleeding, and violent pain of the lower abdomen that usually starts on one side, but then may spread to the other as well. Appendicitis is often differentiated by initial pain around the umbilicus or upper abdomen, and then moving to the lower right abdomen with accompanying vomiting, nausea, and other digestive symptoms. Rebound pain at McBurney's point is often present in cases of acute appendicitis. McBurney's point is located over the right side of the abdomen and is 1/3 of the distance from the anterior superior iliac spine to the navel. This point roughly corresponds to the most common location of the base of the appendix where it attaches to the cecum. Note, however, the rebound pain at McBurney's point may also occur in cases of acute PID. Hospitalization is required for these surgical emergencies. Chronic PID includes leukorrhea, chronic lower abdominal pain, distension and tenderness upon palpation of the lower abdomen, and indications include painful intercourse, menstrual irregularities, including dysmenorrhea, and prolonged menstrual bleeding. Also, infertility may occur, lower abdominal masses may be present, and lumbosacral pain exacerbated by the menstrual period or sexual intercourse may also appear. In the United States, more than 750,000 women experience an episode of PID annually. Over 100,000 women become infertile annually, and more than 150 women die annually from PID or its complications. Notably, a large proportion of ectopic pregnancies are due to PID-related complications. One difficulty in administering early treatment for PID is that chlamydia-related PID may be completely asymptomatic at onset. Biomedical treatments include antibiotics, surgical drainage of abscesses, and surgical removal of affected areas. For salpingitis, that is fallopian tube infections, early administration of antibiotics may prevent the exudate from creating adhesions and blockages in the fallopian tubes that can lead to things like ectopic pregnancies and infertility. We'll take a look at how to treat some of these issues with herbal medicine later in the course. Bed rest and IV fluids may be given as supportive measures. Notably, antibiotic-resistant episodes of PID may be treated with multiple exploratory surgical procedures. Follow-up care involves pelvic examinations and cultures, and recurrent episodes may be preventable by treating male sexual partners for sexually transmitted diseases. Now, that's mostly a biomedical overview. Let's take a look at traditional Chinese medicine. In TCM, pelvic inflammatory disease is characterized under several classifications, including dysmenorrhea, leukorrhea, menorrhagia, that is abnormally heavy bleeding at menstruation, infertility, and palpable masses. PID is the inflammation of the cervix, uterus, fallopian tubes, ovaries, broad ligaments, peritoneum, and/or connective tissues of the pelvic cavity. Infectious scarring of internal tissues may lead to infertility. Lower abdominal pain and vaginal discharge, leukorrhea, are the predominant symptoms. So again, lower abdominal pain and leukorrhea are the predominant symptoms of PID. And PID is the invasion of damp heat and toxins causing qi and blood stagnation in the lower jiao. Again, PID is the invasion of damp heat and toxins causing qi and blood stagnation in the lower burner. The acute stage is characterized by heat more than damp, and the chronic stage is characterized by damp more than heat combined with qi and blood stagnation. Chronic stage PID often combines with qi and yin deficiency. For the treatment of chronic PID, general treatment principles are often a combination of clearing heat and toxins and resolving damp heat lingering from the acute stage, combined with treating the sequela. Treatment principles include invigorating the blood, regulating the qi, expelling dampness, warming the channels, transforming phlegm, and expelling stagnation. Biomedicine attributes PID primarily to exogenous pathogenic factors. However, traditional Chinese medicine also recognizes endogenous causes and exacerbating factors. So PID may be caused or complicated by liver qi stagnation that then transforms into fire. This leads to heat in the blood, and we see a lot of bleeding disorders as a result. Liver qi stagnation may also transform into liver and gallbladder damp heat. Also, any form of heat stagnation may lead to the blood stasis associated with PID. So again, there are infectious causes like gonorrhea and chlamydia that are recognized within Chinese medicine, but also qi stagnation transforming into fire and turning into heat in the blood is a process by which PID can be caused or exacerbated. Let's take a look at some common herbs before we jump ahead to formulas. Herbs that clear heat and toxins, regulate qi, and invigorate blood address the central disharmonies found in PID. Baizhang Qiao is a standout because it clears heat and toxins, drains pus and abscesses, and removes blood stasis. Baizhang Qiao's ability to move the blood helps to relieve pain caused by PID. This is why Baizhang Qiao is also valuable in the treatment of appendicitis, peritonitis, postpartum abdominal pain, dysmenorrhea, and inflammation of the intestines. Baizhang Qiao enters the large intestine, liver, and stomach channels and is cold, pungent, and bitter. Baizhang Qiao. Hung Tang, red vine, also known as dashui tang, is also a very important herb for the treatment of PID. It also clears heat and toxins and dispels blood stasis like Baizhang Qiao. So these are two great herbs because they are specifically suited to the core of PID. Once again, a very valuable herb. Hung Tang is neutral and bitter and enters the large intestine and liver channels. Hung Tang relieves blood stasis-related pain and is an important herb for the treatment of intestinal abscesses and abscesses due to PID because it clears heat and toxins and invigorates blood. Hung Tang is also valuable in the treatment of appendicitis, injuries, joint pain, and dysmenorrhea. Let's take a look at one more single herb before we go on a little. Lulu Tang. This is a very special herb. Lulu Tang, translated as all roads open, is an important herb for the treatment of PID because it moves qi and blood in the channels and collaterals. Lulu tongue is also helpful because it promotes urination to drain the dampness and expels wind. Like the other herbs mentioned here that invigorate blood, Lulu tongue should not be used for pregnant women. So again, we'll be going over a lot of herbs, but careful with the invigorating blood herbs. Lulu tongue is neutral, bitter, and enters the liver and stomach channels. Lulu tongue helps to relieve lower abdominal pain and back pain due to PID from its ability to move qi and blood. Its ability to move qi and blood and also to promote urination makes Lulu tongue an excellent choice for treating fallopian tube blockages and pelvic region adhesions due to damp stagnation and blood stagnation. Lulu tongue is appropriate for use in both acute and chronic PID. Lulu tongue also treats joint pain and traumatic injuries. Lulu tongue has a general anti-inflammatory effect and expels wind. As a result, Lulu tongue treats skin and nasal allergies. Lulu tongue moves the qi and blood and enters the liver and stomach channels, making this herb also helpful in resolving post-surgical adhesions, and is also very helpful for the treatment of endometriosis. Note that endometriosis, an entirely different disorder, can be distinguished from pelvic inflammatory disorder by a few indicators. Leukorrhea is more prevalent in PID than endometriosis, and PID pain is typically worst in the acute onset and then lessens in chronic cases. Endometriosis pain worsens over time and typically builds in intensity starting at the onset of each menstrual cycle. Chronic PID may involve a subacute flare-up of pain prior to menstruation, whereas endometriosis pain, its flare-ups are less likely to occur prior to menstruation. Rather, it comes on with menstruation and builds throughout menstruation. A key indicator of PID is leukorrhea. Red, yellow, or white belt leukorrhea are present when there is disruption of the Dai, Chung, and Ren channels due to damp heat in the lower burner, or qi and blood deficiency in the girdle penetrating and conception of the Dai, Chung, and Ren. White belt leukorrhea is characterized by white or clear vaginal discharge and is without odor. It involves spleen, qi, and or kidney yang deficiency with excess dampness. Yellow belt leukorrhea is characterized by yellow vaginal discharge that has a foul odor and involves spleen damp heat or liver and gallbladder damp heat. Red belt leukorrhea is characterized by the presence of blood in the vaginal discharge and involves heat in the blood and or liver heat changing into fire. The presence of leukorrhea is why chungenpi, or chunpi as it's known, is an important herb for the treatment of PID. Chunpi is cold, bitter, and astringent, and enters the large intestine, stomach, and liver channels. Chunpi is an astringent category herb that clears heat and dries dampness and also stops bleeding. Chunpi is an excellent choice for the treatment of red, yellow, and white belt leukorrhea because it clears heat and dries dampness while at the same time exerts an astringent function. Chunpi is therefore applicable for the treatment of many types of uterine bleeding, both for excess and deficiency, including yin deficiency and damp heat as causative factors with those astringent properties. Another reason why Chunpi is an excellent choice for the treatment of PID is that it has antifungal and antiparasitic functions. This addresses the polymicrobial nature of some forms of PID. So Chunpi is also commonly used for the treatment of dysentery and chronic diarrhea, but we like Chunpi as a choice for PID because of its astringent properties and ability to clear heat and dry dampness, and stopping bleeding, a perfect choice. Important factors of susceptibility to PID are very important to look at during an intake. And let's go over 9 of the major factors that precipitate PID. One is sexually transmitted diseases, especially gonorrhea and chlamydia. Another is a uterine foreign object. Now, this is usually an IUD, an intrauterine device, which is a form of birth control. And that type of pain usually starts unilaterally, but it may become bilateral. It's usually actinomycosis, that type of infection, bacterial infection. And this can occur from either a copper-shaped, T-shaped IUD or the progesterone T-shaped IUD. Either way, the modern progesterone style or the old style copper. Third, sexual intercourse 1 day prior to or during menstruation may lead to PID. Surgery in the pelvic cavity. Abortions, especially multiple abortions. Postpartum, anytime in the postpartum period. Miscarriages, especially chronic miscarriages. Another precipitating factor to PID is a nearby organ, such as the urination bladder or the large intestine, transfers the infection to the pelvic region or throughout the pelvic region, especially an appendicitis, which can transfer an infection, or any type of large intestine infection, then transferring throughout the pelvic region. And following the very first time of sexual intercourse is an indicator. So let's take a look at an overview of acute stage PID. Typically, pulse is rapid and slippery, and the tongue body is red with a thick yellow coat. And the classifications in Chinese medicine are damp, heat, and toxins in lower burner. It can also be viewed from 4 levels of when being differentiation. So we can say the Qi level heat with the big fever, the big sweating. That may progress then to the Ying level. And it can also be viewed from a 6 stages point of view, a Yangming stage illness, again with the febrile disease coming on, that then progresses to the Tai Yin stage. So either way we look at it depends on the initial cause, whether it's a cold-induced illness, a heat-induced illness, or we're looking from general TCM terms of damp, heat, and toxins in the lower burner as the cause of acute PID onset. Severe or rebound lower abdominal pain is one of the main indicators of acute PID, and there is red or yellow belt leukorrhea typically, fever, chills, diarrhea, or constipation. So look for those Yangming Fu organ symptoms. Also, there may be burning sensation of the urine, a yellow color, and in some cases there can be a pyogenic, a pus-producing abdominal mass that may be palpable in the abdominal region. So the treatment principle for acute PID is to clear heat and toxins and to clear lower burner damp heat. So an excellent formula for the treatment of acute PID, especially acute fallopian tube infection salpingitis, is a modified version of Da Huang Mudan Tang. The base formula of Da Huang Mudan Tang is originally comprised of Da Huang, Mudan Pi, Mang Shao, Dao Ren, and Donghua Ren. In this presentation, Mang Shao and Donghua Ren are replaced with other herbs, so no Mang Shao, no Donghua Ren. For this presentation, often an acute fallopian tube infection, the pulse is rapid, slippery, or wiry, and the tongue is red and usually with a yellow and greasy coating. The diagnosis: damp heat in the lower burner, Qi stagnation, and blood stasis in the lower burner. So again, classic presentations of PID. Indications would be lower abdominal pain that is worse upon pressure, so excess, and yellow belt leukorrhea, maybe red belt, fever, and chills. Treatment principle: clear heat, eliminate toxins, break blood stasis, drain dampness, and reduce swelling. So the herbs here are 9 grams of Da Huang and then 6 grams each of Mudan Pi and Dao Ren, 9 grams each of Baijian Chao, Jinyan Hua, and Lian Chao, 6 grams of Chuxiao Yao, 9 grams of Yi Ren and Heng Tang, and then 6 grams each of Shanzhizi, Yan Huso, and Chuan Lian Zi. And the dosage is 1 bag per day. Ratio is decocted in 3:1 in water. Note that this formula is especially effective for fallopian tube infection, salpingitis, and in some cases, acute salpingitis symptoms may be mild or unrecognized and therefore become chronic due to lack of treatment, complete lack of treatment. The acute stage tends to last about 2 to 3 days and quickly progresses to the chronic stage. A key diagnostic indicator for this formula is if the patient had sexual intercourse 1 day prior to or during her menstrual cycle, followed by abdominal pain, fever, and chills within 72 hours. Another key factor is if the same pattern occurs following the very first time of sexual intercourse. Baizheng Qiao is added for its ability to clear heat, eliminate toxins, and drain pus and abscesses. And Baizheng Qiao also eliminates blood stasis, thereby relieving pain of the lower abdomen. Again, Baizheng Qiao is an indispensable herb for the treatment of PID. Old friends Jinyanhua and Lian Qiao, which are synergistically paired herbs, are added for their ability to clear heat, eliminate toxins, and work with Baizheng Qiao to treat abscesses. Jinyanhua clears heat and toxins, expels wind heat, and also clears lower jiao heat and dampness. Lian Qiao is particularly helpful because it enters the heart, liver, and gallbladder channels, clears heat and toxins, dissolves nodules, and promotes urination. Lian Qiao is notable for its ability to clear ying, that is nutritive level heat, making it appropriate for the treatment of PID. Qi Yao is added for its ability to clear heat, cool the blood, and relieve blood stasis in pain. One of the most useful herbal medicines in a clinic. Qi Yao is an important herb for the treatment of PID because it treats blood stagnation in the uterus and it treats blood stagnation in the lower abdomen. Qi Yao is also helpful in reducing swelling and abscesses due to heat and toxins and helps to resolve abdominal masses. Qi Yao is helpful in the treatment of dysmenorrhea, irregular menstruation, abdominal pain. It makes it an excellent choice for the treatment of PID. Qi Yao is bitter, cool, and enters the liver channel. Qi Yao has the special ability to clear heat from the urination bladder, and it has a wide variety of uses, including the treatment of eye pain due to heat and rising yang, and the treatment of traumatic injuries. But here, we use it for PID with those incredible blood invigorating properties and its ability to cool the heat in the blood. We'll also see that with a lot of bleeding disorders due to heat in the blood. The Qi Yao is very helpful. So that's interesting because we're not using stop bleeding herbs. We're using blood invigorating herbs to break the stagnation and cool the blood to stop the bleeding. Yi Ren is added for its ability to clear heat, drain dampness, and dispel pus. And Hung Tang clears heat, eliminates toxins, and dispels blood stasis and relieves pain due to blood stasis. Hung Tang functions synergistically with Da Huang, Lian Qiao, and Mudan Pi to treat abscesses, and also combines with Yi Ren to dispel vaginal discharge. So Hung Tang is a great and important herb for the treatment of PID. Zhi is added to sedate fire, drain damp heat, cool the blood, and stop bleeding. So Zhi, also a common and powerful herb in the clinic, works well with Da Huang and Lian Qiao to treat high fever with irritability or delirium. So Zhi, in an acute case, in a severe case, is very helpful to really cool the heat. Here's another combination, Yan Hu So with Chuanlianzi. Now, Chuanlianzi, also known as Jinlingzi. Together, these two herbs comprise the formula Jinlingzi San, or the golden bell seed powder. And they are added to treat liver qi stagnation and fire and liver channel pain. So Yan Hu So and Chuanlianzi are their own formula, but are added into this formula specifically for the qi stagnation and fire and channel pain. Lulu Tung can be added to this formula also to invigorate the blood and open fallopian tube blockages due to PID. So a great formula for the treatment of salpingitis, and this modified version of Da Huang Mudan Tang comes in very handy in these extreme situations. Let's look at some acupuncture point selections, and then we'll get back to some more herbal medicine as well. The following point selections are recommendations from Professor Sharon Fung. During her lifetime, she served as a distinguished department chair of gynecology at Five Branches University and was an inspiring teacher and friend. So for acute PID, choose CV4 and CV3 Ren 4 and 3, Zhegang, GB27 and 28, spleen 6, spleen 10, large intestine 11 and 4, stomach 36, stomach 40, liver 5, and liver 3. So before going forward, I want to thank Peter Dedman for letting me use images from a manual of acupuncture in this webinar, including the images of the Dai Mai vessel and GB26. And I strongly recommend A Manual of Acupuncture, his book. It is one of the best English language acupuncture textbooks available. A Manual of Acupuncture is available in print, in CD-ROM, and there's a special version in the iPhone and iPad format. If you like, you may visit healthcmi.com and search for A Manual of Acupuncture. We do a lot of book reviews and app reviews, and you can learn a lot more about A Manual of Acupuncture at healthcmi.com. So looking at the points, GB27 and 28 are meeting points of the gallbladder, foot Shaoyang channel, with the Dai belt or girdle channel, the Dai Mai, the belt channel, the girdle channel. Grandmaster Wei Shui noted that GB27 Wu Shu treats lower abdominal pain, lower back pain, inflammation of the uterus, and orchitis. Professor Shui also noted that GB28 Wei Dao is useful for the treatment of uterine inflammation, pain of the lower abdomen, and constipation. Both points regulate the Dai channel. They benefit the lower jiao, the lower burner, and treat leukorrhea. Also, lower abdominal pain, back pain, and irregular menstruation. When we take a look at the point prescriptions for chronic PID, we'll also review GB26, which is a primary point used in the treatment of chronic PID, along with GB27 and 28, which are also appropriate, in this case for the acute PID, but the three of them can be used for chronic PID very successfully. Together, all 3 points, again, GB26, 27, 28, are the coalescent points of the Dai channel. Treatment of the Dai channel is significant in several respects. It is always involved in disharmonies leading to leukorrhea. The Dai Mai vessel is also indicated for the treatment of infertility, ovarian inflammation, and general disorders of the ovaries, abdominal pain, and pain around the waist. Together, these properties make the Dai Mai vessel, the belt channel, especially relevant for the treatment of PID. And we'll take a closer look at GB26 when we cover chronic PID acupuncture points. CV3 and CV4 are meeting points of the conception channel with the spleen, liver, and kidney channels, and they benefit the uterus and lower burner. CV3 regulates Qi, drains damp heat, and treats leukorrhea. Zhegang benefits the uterus, regulates Qi, stops pain, regulates menstruation, and stops uterine bleeding. And of course, the easy way to remember Zhegang, it's 3 sun out, 4 sun down from the navel. Spleen 6 and spleen 10 regulate menstruation, invigorate blood, and treat leukorrhea. Alternately, spleen 8 is a Qi cleft point which regulates the uterus and harmonizes blood and is an effective way of treating dysmenorrhea with excess bleeding, irregular menstruation, and abdominal pain. Large intestine 4 and 11, a staple in the Chinese medicine clinic, are commonly combined to clear heat, expel wind, and stop pain. Large intestine 11 cools the blood, drains damp heat, regulates Qi and blood, and treats high fever. Stomach 36 is a command point for the treatment of abdominal disorders, clears Yangming level heat, and treats nausea, vomiting, and abdominal pain. There is a modern misconception that stomach 36 should not be used in combination with external pernicious influences. However, stomach 36 is an excellent choice for clearing heat in combination with reducing, that is, sedating needle techniques, and is classically indicated for this use during febrile diseases and for stomach excess heat. Stomach 40, it's the low connecting point of the stomach channel and transforms phlegm. Dampness, also a great choice. Liver 3 is the source yuan point of the liver channel, and liver 5 is the connecting, the low point of the liver channel. They regulate the qi and the menses and benefit the lower burner. Liver 5 clears damp heat in the lower burner. Liver 3 treats leukorrhea and lower back pain, referring to the abdomen. And together, we can also use the 4 gates combination to stop pain. So large intestine 4 and liver 3 are a great combination as well. Let's also take a look at another herbal formula for acute PID that is widely used in practice. It's available in pill form, powder form, loose herb form, common, staple, and incredibly effective. And we'll look at how to modify it with yet another common formula, but equally as effective in severe acute cases. And then later we'll take a look at some more subtle treatments for chronic PID and how we take care of that when there's a mixture of cold and heat, when there's deficiency in excess. But here is definitely extreme excess when we look at Huanglian Jie Du Tang. And as always, I strongly recommend using unsulfured herbs without additives from only the best sources, both for purity and for potency. So, for this presentation using Huanglian Jie Du Tang, the pulse is rapid and full. There's a red tongue body and yellow coating, and the diagnosis is damp heat in the lower burner and fire toxins in all 3 burners. Indications: acute lower abdominal pain, red or yellow belt leukorrhea, high fever, mental restlessness, delirium, dry mouth, dry throat, thirst. The urination is concentrated with a dark yellow color and a burning sensation. So a lot of fire here. So the treatment principle is to purge the fire, release the toxins, and clear damp heat. So the ingredients, 6 grams each: Huanglian, Huangqin, Huangbai, Zhizi. So if there is excessive vaginal or internal bleeding due to heat in the blood or nutritive yin level heat, we're going to make a modification to Huanglian, Huangqin, Huangbai, and Zhizi, which is already incredibly strong. Now we want to get at that heat in the blood. We'll take a modified version of Shijiao Di Huangtang. We're not putting any Shijiao in there. I don't know of anyone who really does. It's unconscionable to think someone would use a rhinoceros horn in this day and age. Instead, what we're using nowadays, of course, is a water buffalo horn. You'll have to use a higher dosage. Here we'll indicate 12 grams of Shui Niu Jiao, but you can use even more. Also, 12 grams of Sheng Di Huang, 6 grams of Chuxiao, and 6 grams of Mudan Pi. And together with Huanglian Jie Du Tang, we'll have one strong formula for the treatment of acute PID. Careful with this, it's difficult on the stomach qi. Dosage is 1 bag per day and is decocted 3-to-1 in water. So that's a nice look at a couple formulas for the treatment of acute PID and some acupuncture points. But let's take a look at chronic stage PID. Here the pulse is usually wiry or slippery. The tongue is purple with a white or yellow coating. And the diagnosis is qi and blood stagnation. Indications for chronic stage PID. Well, lower abdominal pain, yellow or white belt leukorrhea, intermittent or constant pain of the lower back, irregular menstruation, prolonged menstrual bleeding, and in some cases, lower abdominal palpable masses and infertility. Treatment principle: invigorate blood to remove blood stasis and regulate qi. So diagnostic patterns and common complications are important to go over when we're talking about chronic PID. Chronic PID often involves the treatment of unresolved subacute pelvic region infections due to residual, lingering damp heat in the lower burner remaining from the acute PID. White and yellow belt leukorrhea are often indicators. Both Qi and blood stagnation and excess heat in the lower burner may lead to abnormal uterine bleeding. Menorrhagia, that is abnormally heavy bleeding at menstruation due to damp heat in the lower burner, occurs when heat attacks the Chung and Ren channels, creating heat in the blood, and that causes the reckless movement of blood, hence the prolonged menses or abnormal uterine bleeding, so a common complication with chronic PID. Disorders such as chronic spotting and menorrhagia are not principally treated with stop bleeding category herbs in this differentiation pattern. The bleeding is stopped, however, by clearing and draining damp heat and invigorating blood. In one case history, a patient presented with frequent vaginal spotting. Upon investigation, 2 years prior, the patient underwent conization, which is the surgical excision of tissue from the cervix. This was done for removing stage 2 cervical dysplasia, which is the abnormal growth of cells lining the cervix, trying to prevent cancer. Onset of spotting followed antibiotic treatment for infectious complications due to the conization procedure. And the tissue injury from conization created blood stasis and allowed for a damp heat infectious state to lodge in the lower burner. Here, the simple application of patent medicines Longdan Siegantang for the damp heat in the liver channel and Guizhi Fulingwan for blood stasis in lower burner resolved the condition. This we can easily obtain in patent medicine form, so it's easy for compliance, and yet a very, very powerful combination. In another scenario, fallopian tube blockages may form from residual congealed pus following the acute infectious stage of PID. This is indicated by lumps or pain in the fallopian tube region, abdominal pain, irregular menstruation, pain during bowel movements, dysmenorrhea, painful menstruation, and the reduction of abdominal pain upon the release of blood clots during menstruation. In some cases, the original acute fallopian tube infection, the salpingitis, may be mild or unrecognized and therefore become chronic due to lack of treatment. So again, when looking at fallopian tube infections, pain during bowel movements may come up, and also reduction of abdominal pain upon the release of blood clots may also indicate, along with the possible palpable masses, which may not be possible in all cases, but it is certainly an indicator. Acute PID tends to last 2 to 3 days, and a common diagnostic indicator for acute PID is sexual intercourse 1 day prior to or during the menstrual cycle, followed by abdominal pain, fever, and chills 72 hours later. Here, the fallopian tubes may form obstructions and adhesions from the congealing of discharge produced in the acute stage. One or both of the ovaries may also adhere to the fallopian tubes. So, one very important thing to look at is that discharge remaining in the fallopian tubes in a fluid-like state moves downward between the uterus and large intestine. So we have the fluid moving downward through the uterus and large intestine upon standing or sitting, and may cause pain associated with menstruation, bowel movements, or even standing or sitting. So this will indicate that there is potentially discharge remaining in the fallopian tubes in a subacute infectious state. Later, we'll take a look at a modified version of Guizhi Fulingwan that addresses exactly this condition. Another form of chronic PID is dampness without heat, which is indicated by white belt leukorrhea. In exhaustive, long-standing chronic PID, there may be cold stagnation in the liver channel, which is indicated by lower burner pain relieved by warmth, and Qi, blood, and yin deficiency. Now, this is a colder state, whereas before was a warmer state that we were looking at, one of the complications with the damp heat. Actually, even red belt leukorrhea can occur in that state that we spoke of prior, where in this case, it's strictly white belt leukorrhea. When there's more complicated mixtures, you may see a little yellow belt leukorrhea. So here we have, again, a chronic PID presentation with a complicated mixed pattern of both cold and heat. We have the cold stagnation of liver channel, the Qi blood, and yin deficiency. We'll also be looking at a modified version of Jiao Aitang that addresses lower abdominal pain and vaginal bleeding due to cold deficiency created by chronic illness, combined with unresolved blood stasis, heat in the blood, damp heat and lower burner, and heat and toxins. So we'll look at that formula a little later in this course. And this formula is especially useful for many chronic presentations of endometritis, which is inflammation of the uterine lining. In this presentation of PID, the endometrium, the inner mucous membrane of the uterus that sheds during menstruation, becomes infected and therefore bleeds. Untreated infertility may result from endometritis. In some cases, PID causes constitutional depletion with no heat signs at all. Modifications of Yogui-1 treat the resulting spleen, Qi, and Kidney Yang deficiency. Indications include dull pain of the lower abdomen, dull pain of the lower back, white belt leukorrhea, and a pure cold state, no yellow belt leukorrhea, weakness, a feeling of cold in the body, and a cold sensation in the uterus region. Also poor appetite, loose stools, irregular menstruation, and menstrual pain that worsens after the menstrual flow ceases. The treatment principle is to tonify spleen Qi, tonify kidney Yang, and resolve dampness. Let's take a look at some acupuncture points, and then we'll get into some great herbal formulas to look at various presentations and complicated mixed patterns of chronic PID. So here are some classic points for the treatment of PID used by Professor Sharon Fung. We have covered many of her herbal formulas for the treatment of PID in the past, and look forward to more webinars featuring more of her incredible formulas that she worked with during her lifetime. So for chronic PID, stomach 36, stomach 25, stomach 38, spleen 10, spleen 9, GB 26, 27, and 28. All of the coalescent points on the Dai Mai, and CV 6, 4, and 3. So stomach 36 is a command point for the treatment of abdominal disorders and treats nausea, vomiting, and abdominal pain. Stomach 36 is the lower Hussey point of the stomach and powerfully tonifies Qi and blood. Stomach 25 is the alarm point of the large intestine, regulates Qi and blood, and treats both dampness and dam heat. Stomach 25 treats endometritis, irregular menses, leukorrhea, abdominal pain, and lower back pain. And stomach 25 is also effective in treating uterine masses arising from Qi and blood stasis. Stomach 38 is effective for the treatment of abdominal pain. And again, be sensitive to your patient. If local stimulation is too much, then think distal. If you're able to get in there with local stimulation and the patient's constitution will allow that and respond to it, then go ahead with that track of treatment. Certainly many great Chinese medicine physicians throughout the centuries have used, for example, stomach 25 very effectively. Spleen 10, Shui Hai, is translated as the sea of blood, and spleen 10 invigorates the blood and cools the blood. Spleen 10 treats irregular menstruation, dysmenorrhea, abnormal uterine bleeding, and leukorrhea. Spleen 9 is the Hussey and water point of the spleen channel, and spleen 9 transforms dam stagnation and benefits the lower burner. Spleen 9 treats abdominal pain and distension, dysmenorrhea, and irregular menstruation. GB 26, 27, and 28 are all geared towards treating leukorrhea and abdominal pain, each of them. And they are chosen for the relationship to the Dai channel, the belt channel. Again, I want to thank Peter Dedman, co-author of A Manual of Acupuncture, for permission to show this slide today of GB 26 in today's webinar, as we feature that on the Dai Mai vessel. GB 26 is actually called Dai Mai. It's translated as girdle vessel, so it has the name of the vessel itself. And GB 26 regulates the Dai Mai and alleviates damp heat. In addition to treating abdominal and lower back pain, GB 26 treats irregular menstruation, endometritis, and red, yellow, and white belt leukorrhea. The Dai Mai vessel regulates the upward and downward movement of qi and the horizontal movement of qi. In a manual of acupuncture, it is noted that the character for leukorrhea Dai Sha is composed of Dai, meaning belt or girdle, and Sha, meaning downward. So leukorrhea is also part of that improper movement of qi. GB26 is one of the most potent acupuncture points for regulating the Dai Mai vessel, and it is especially efficacious in the treatment of leukorrhea. Leukorrhea is a main indicator for Dai Mai vessel disharmony, which is why it is so important to treat that. If one wants to go distal, maybe use the master point, the confluent point, as we sometimes call it, GB41. We can use an 8 extra channel distal point like that, combining TB5, Sangel 5 with GB41. Here we're going directly to GB26. So see if local stimulation is appropriate and extremely effective for leukorrhea. CV6 Qi high is translated as the Sea of Qi. Let's look at that point in a bit. But getting back to GB41 with triple burner 5, those might be good choices, particularly where there's irregular menstruation combined with headache. So those are a nice choice in that situation. CV6 Qi high regulates Qi, tonifies the Qi and kidneys. It harmonizes the blood, regulates the Chung and Ren channels, the penetrating and conception channels, and dispels dampness. CV6 treats abdominal pain, irregular menses, dysmenorrhea, and leukorrhea, and abnormal uterine bleeding. CV4 benefits the kidneys, tonifies and regulates the qi, and it's the front alarm point of the small intestine and is the meeting point of the conception channel with the three-leg yin channels, the spleen, liver, and kidney. The Yellow Emperor's Classic notes that the Chung, the penetrating or the vitality channel, originates at CV4. CV4 treats abdominal pain, irregular menses, dysmenorrhea, and leukorrhea. So CV4, a very important point. CV3 is the intersection point of the three-leg yin channels and the front alarm point of the urination bladder. CV3 regulates the uterus, drains damp heat, regulates the menses, and assists the transforming function of qi. And CV3 treats irregular menses, dysmenorrhea, lower abdominal pain, lower back pain, leukorrhea, and vaginitis. So we can see why CV643 are not only a tonic combination, but can also relieve some conditions due to excess or deficiency. So getting back to herbal medicine, let's look at a modified version of Guizhi Fuling Wand that is particularly effective for the treatment of chronic fallopian tube infections with obstructions and adhesions. So we've looked at an acute formula. Let's switch over to a chronic PID formula for salpingitis. And also the concomitant obstructions and adhesions. So here the pulse will be choppy. The tongue will be purple. And the diagnosis is blood stasis in the lower burner. There is lower abdominal pain or distension, irregular menstruation, menstrual blood clots, antedated dysmenorrhea, that's pain prior to menstruation, mild and persistent uterine bleeding, lower abdominal masses, especially with pain upon palpation. So break the blood stasis. So we have the masses, we have the irregular menses, the blood clotting, the lower abdominal pain, the whole package is there. We have to go after it and fix it. We don't want this patient to wind up needing chronic use of antibiotics and multiple surgical procedures, and when a simple herbal formula applied correctly can just avoid that circumstance for our patient. So, the herbs. Guizhi. Nothing like a little cinnamon branch. 6 grams. Sometimes I even like to show Guizhi to my patients. It's just such a delightful herb. It's hard not to like it. I'm trying to always encourage compliance and help the patients have a relationship with the herbal medicine and get them to love the herbs as much as I do. Fuling 9 grams, also 6 grams each of Mudampi, Daoren, and Chishao. Also 15 grams each of Huangqi and Zhaojiaoci, 9 grams of Shangfu, and 6 grams each of Sanling and Eizhu, the paired herbs. So the dosage is 1 bag per day, and start following the end of the menstrual cycle. Use it for 5 days, then discontinue till after the next menstrual cycle has completed. So again, consume it for 5 days per month, right after the menstrual cycle ends. This great formula was recommended by one of the true greats in gynecology and obstetrics in Chinese medicine, Professor Xiaohua Li, who recommended this formula as an effective treatment for chronic fallopian tube infections with obstructions and adhesions, and she had tremendous clinical successes. The fallopian tubes may become blocked from the congealing of discharge produced in the acute stage. The ovaries may have adhesions to the fallopian tubes by the same process. Discharge remaining in the fallopian tubes in a more fluid-like state moves downward between the uterus and large intestine upon standing or sitting, and the displacement of discharge creates bowel movement pressure and pain associated with menstruation. Chronic fallopian tube infection key indicators include irregular menstruation, abdominal pain, and the reduction of abdominal pain upon the release of blood clots during menstruation. So again, chronic fallopian tube infections. Chronic fallopian tube infections are distinguished from endometriosis by the character of the pain. So endometriosis, again, is abdominal pain that worsens with each period and increases over time, whereas fallopian tube infections tend to lessen after the acute stage has ceased. And endometriosis-related pain worsens towards the end of the menstrual cycle and continues afterwards due to compounding blood stasis, whereas chronic fallopian tube infection pain often starts before the menstrual flow. This would be inconsistent with endometriosis, so it helps to distinguish and make that differentiation between the two. Both conditions can lead to infertility. So the base formula, Guizhi Fulingwan, treats blood stasis in the womb with presentations such as uterine bleeding with clots, lower abdominal pain, dysmenorrhea, and lower abdominal masses. Here, the formula is modified to enhance its ability to treat PID and chronic salpingitis. Huangqi is added to tonified qi. And Zhaojiaoci. Zhaojiaoci eliminates toxicity. Zhaojiaoci drains pus. Zhaojiaoci activates blood circulation. Zhaojiaoci reduces swelling, and it is recognized as an important herb for the treatment of fallopian tube obstructions or adhesions due to PID. So Zhaojiaoci, I want to emphasize, eliminates toxicity, drains pus, and activates blood circulation. It can break the stagnation and break through it, and we really see that it's an herb you don't want to stick your hand in the jar too quickly because it's so pointy, and that gives us insight into its nature to break open stagnation. Baijiang Chao is added for its ability to clear heat, eliminate toxins, and drain pus and abscesses. Baijiang Chao also eliminates blood stasis, thereby relieving pain of the lower abdomen. Dao Ren activates blood circulation and removes blood stasis. And combined with Baijiang Chao and Zhaojiaoci, Dao Ren treats adhesions and obstructions in the fallopian tubes related to PID. Shangfu is added for its ability to regulate the qi, treat irregular menstruation, and relieve menstrual pain. So great for circulation. And Sanling and Eizhu function synergistically as paired herbs, and they strongly break blood stasis. So this can help move the blood strongly. So we looked at a formula for chronic fallopian tube infections. Let's turn and take a look at a formula that's great for menorrhagia. Menorrhagia is abnormally heavy bleeding during menstruation. And this next formula is exceptional for the treatment of menorrhagia and is a common herbal formula that we find in a Chinese medicine clinic used for many things. It's available in concentrated powders, it's available in raw herb form, it's available in pill form, and it's one that is no stranger to many clinics, and that's Gujingwan. It's a great formula for menorrhagia, abnormally heavy bleeding during menstruation. Gujingwan, when we're treating PID, look for a rapid, wiry or slippery pulse. The tongue will be red, maybe with a yellow coating, and the diagnosis is damp heat and toxins in the lower burner. So indications include, of course, menorrhagia, abnormally heavy bleeding at menstruation, even continuous, incessant, non-stop menstruation, abnormal uterine bleeding, vaginal spotting with a bright red flow and dark purple clots, red or yellow belt leukorrhea, again we're looking at heat, lower abdominal pain, mental restlessness. The urine will usually have a concentrated yellow color, maybe a burning sensation, maybe even blood in the urine. So for Gujingwan, the treatment principle is to nourish the yin, clear damp heat and toxins in the lower burner, stop bleeding, and astringe leukorrhea. So the ingredients: Huangqin, 12 grams. Huangbai, 6 grams. Chungenpi, also known as Ebai, 9 grams. Baishao, 12 grams. Guiban, 30 grams. And Changfu, 6 grams. Over the many courses I've given over the years, a lot of people have asked for something instead of Guiban, so remember to nourish and protect the yin, which is an essential aspect to Gujingwan, to be able to clear damp heat and toxins in lower burner while protecting the yin. So use another herb that protects the yin in place of Guiban if you do not want to use the turtle shell. So the dosage for Gujingwan is 1 bag per day, and the ratio is, of course, 3:1 decocted in water for this formula. So it's a standard preparation when making the raw herb formula. Gujingwan stops menorrhagia. And the menorrhagia is due to damp heat in the lower burner. And again, it protects the yin. So this formula is effective for patients with underlying yin deficiency and liver Qi stagnation that causes heat, which then attacks the Chung and Ren channels. So this disturbance, where the liver Qi stagnation festers and causes heat, attacking the Chung and Ren, creates heat in the blood. And that heat in the blood causes reckless movement of blood, and hence the prolonged menses or abnormal uterine bleeding. So we do see heat in the blood as a common part of a common sequela of damp heat and heat and toxin forms of PID. So Gujingwan, a great formula. The beauty of it is it's commonly available, even in patent medicine form. So it's something that's very accessible to patients, and we have just something that we can get compliance with. Let's take a look at another formula, and this one is for endometritis, inflammation of the uterine lining. So we looked at chronic fallopian tube infections, and then we moved over to Gujingwan to look at menorrhagia, and now we're going to look at a modified version of Jiaowai tongue that is especially effective for the treatment of endometritis, inflammation of the uterine lining. So look for a pulse that is wiry. The tongue will be purple because we're looking for blood stasis in the lower burner. So the purple tongue is the indicator there, along with the wiry pulse for that stagnation. Indications include a prolonged menstrual flow or intermittent vaginal bleeding, leukorrhea, discomfort with bowel movement, abdominal pain, abdominal tenderness upon palpation, abdominal distension, and possibly constipation or even fever. So to treat this form of PID, including with the presentation of endometritis, inflammation of the uterine lining, we're looking to break the blood stasis to stop bleeding. And of course, that's very interesting because ordinarily we want to use stop bleeding herbs to stop bleeding. And here it's actually the blood stasis itself that is festering and contributing to the damp heat stagnation. And we want to move the blood and clear the damp heat to stop bleeding. A little different. And the dosage here will be 1 bag per day and decocted 3-to-1 in water. So the ingredients: Sheng Di Huang, 12 grams. And to complement Sheng Di Huang with cooling the blood, Qi Xiao, 9 grams. Dang Gui, 9 grams. Chuan Sheng, 6 grams. So already we're starting to warm and tonify and mix with cooling. Aye, the charred variety, 3 grams. So warming property as well. Again, we're looking at a mixed presentation here now. Heat and cold mixing. San Qi, 9 grams. Or Tian San Qi, Tian Qi. Pao Jiang, 12 grams. Shangfu, 9 grams. Yan Hu So, 9 grams. Pu Gong Ying, 30 grams. So strong clear heat and toxin property to this formula. And Huang Qin, 9 grams. Should the bleeding continue, increase San Qi to 15 grams. Increase Pao Jiang to 12. And up Sheng Di Huang to a dosage of 18 grams. And Sheng Di actually in general can be up to quite a high level. I know another one of our authors at Health CMI, Professor Richard Liao, has always said that there is an upper range to Sheng Di Huang. Just be careful with the cloying properties. So Professor Liao has always said be careful with the cloying properties, but nonetheless, in larger quantities, it's very beneficial, Sheng Di and even Shu Di for tonifying more. Just the cloying properties can cause some problems, and of course it may move the stool quite a bit or cause distension in severe cases. So we can mix it with Chen Pi, Sharen, many things to help that and improve digestion of the herbal medicine. So this formula is especially useful for endometritis, inflammation of the uterine lining. And in this presentation, the endometrium, that is the inner mucous membrane of the uterus that sheds during menstruation, becomes infected and therefore bleeds. Infertility may result from endometritis. Here, modified Jiao Ai Tong addresses lower abdominal pain and vaginal bleeding due to cold and deficiency created by the chronic illness. And this is combined with unresolved blood stasis, heat in the blood, damp heat in the lower burner, and heat and toxin. So there's a lot going on here. This formula is a variation of the original Jiao Ai Tong. And Jiao Ai Tong is itself the historical antecedent to Subu Tong, the 4 ingredients decoction, which is perhaps one of the most well-known of all the herbal formulas. Jiao Ai Tong has the primary function to stop bleeding and treats injured and deficient Cheng and Ren, penetrating and conception vessels. So Jiao Ai Tong is modified to increase the blood invigorating and heat clearing properties of the formula. This changes the focus of Jiao Ai Tong from primarily treating bleeding to the deficiency and coldness in the Chung and Ren, to additionally treating bleeding to blood stagnation, damp heat, and heat and toxins, also heat in the blood. So there's a shift there. It is not recommended to add additional stop bleeding category herbs, as it is important to break the blood stasis and use those herbs as the primary method to stop bleeding along with the heat clearing herbs. Looking at the classical presentation of Jiao Ai Tang, and that's from the Essentials of the Golden Cabinet, the Jingui Yale, is Jiao, Ai, Shengdi Huang, Dangui, Chuan Sheng, Xiao Yao, Gan Chao, and here you can see we've changed it a bit and gone after some of the heat clearing properties, and it makes it a beautiful formula to treat mixed presentations. This presentation of Jiao Ai Tang excludes Jiao to ensure that the bleeding is stopped by breaking the blood stasis. However, this formula is not cooked with rice wine as in the original preparation of Jiao Ai Tang, so it has less of a moving property without the alcohol. Chi Xiao replaces Bai Xiao, and that enhances the cooling and invigorating blood properties of the formula, where Bai Xiao had more of a tonic property and a softening property also. Paozhong, that is roasted ginger, is astringent, it stops bleeding, and it's added to warm the channels to assist in breaking blood stasis in order to help fight the infection. So warming the channels does help to create movement and work synergistically with the other herbs. Sanqi, Tianqi, is added for its special property to stop bleeding, or stop uterine bleeding in this case, without creating blood stagnation, which is why we love it so much in the clinic. So again, Tian San Qi is something that's treasured because it does let us use stop bleeding herbs in this situation and many other situations like it without creating blood stasis. So very special herb. Also note that the charred variety of Aye is used to enhance the stop bleeding function of the herb also. Charred Aye. And Aye, of course, warms the channels, and that assists in stopping gynecological related bleeding. Combined with Shang Fu, Chuan Sheng, and Dangui, Aye addresses deficiency and cold of the lower burner with abdominal coldness and pain, or even irregular menstruation with pain. And Shang Fu and Yan Hu So address blood stagnation and dysmenorrhea. Huang Qin is added to clear damp heat. Pu Gong Ying is added because it enters the stomach and liver channels, clears heat and eliminates toxins and eliminates damp heat. So Pu Gong Ying we see a lot in the clinic for the treatment of skin disorders and infections. Here we are using its anti-infectious properties to assist in clearing the heat in this formula for the treatment of endometritis. So a modified version of Jiao Ai Tang for endometritis, a straight Gujing one for menorrhagia, and of course we had a modified version of Guizhi Fuling one for chronic fallopian tube infections. And again, that was a great presentation with Fuling, Mudampi, Daoren, Chixiao, Huangqi, Zhao Jiao Ci to break that stagnation, Shangfu, and then Sanling and Eizhu to really break the blood stasis and cut through the adhesions and blockages due to the chronic fallopian tube infection. So there's 3 great formulas for the treatment of chronic PID. Let's take a look at another formula that focuses primarily on Qi and blood stagnation. It's a modified version of Zhuhuan. And straight Zhuhuan is available in pill and powder form, pre-made commonly, but this version's a little different. Look for a wiry pulse. The tongue might be purple with a thin white coating. And again, the diagnosis is Qi and blood stagnation. So the indications for this modified version of Zhuhuan is lower abdominal pain and inguinal region pain, lower abdominal distension, lower back pain, and irritability. So in some cases, white or yellow belt leukorrhea will be present, accompanied by antedated dysmenorrhea, irregular menstruation, and lower abdominal masses. The treatment principle is to regulate Qi and vitalize the blood. Dosage 1 bag per day, decocted 3:1 in water. So the ingredients: Zhuhe, 6 grams. Chuanlianzi, 6 grams. Yan Hu So, 6 grams. Danshen, 9 grams. Chishao, 6 grams. Shangfu, 9 grams. Lu Tang, 6 grams. Again, a very, very specific herb for this condition. And Ganchao, 6 grams. So together, that's our base. Now, there are some complications that can arise. For example, when there is persistent abdominal masses with sharp and fixed lower abdominal pain, purple clots in the menstrual flow, then add the following blood-invigorating herbs: Sanlang and Eizhu, that paired grouping of herbs that strongly breaks the blood. So careful with deficiency, of course. This is for excess. Sanlang, 6 grams. Eizhu, 6 grams. Now, another modification to the base would be damp heat symptoms with yellow belt leukorrhea in particular. Then add Hung Tung, 9 grams. Baijiang Chao, 9 grams. And Huang Bai, 9 grams. So again, Hung Tung and Baijiang Chao we see a lot, moving the blood and also clearing the heat. An incredible combination for the treatment of PID. Now, if there's red belt leukorrhea, that's blood in the vaginal discharge, add the Hung Tung, add the Baijiang Chao, add the Huang Bai, and also add that, with that astringent property also now, Chungen P, also known as Ebai P, add that 9 grams. In this presentation, Zhuhe, Chuanlianzi, and Yan Hu So are maintained from the base formula to regulate Qi in blood and stop pain. Danshen is added to treat abdominal pain and masses due to blood stasis, while at the same time to protect and nourish the blood. As an aside, Danshen has a special property to move the blood through the small vessels of the body. Chishao is added for its ability to clear heat, cool the blood, and relieve blood stasis and pain. And remember that Chishao has that special property to invigorate the blood both in the abdomen and in the uterus, making it absolutely invaluable in the clinic and for treating PID. Shangfu is added for its ability to regulate Qi, treat irregular menstruation, and relieve menstrual pain. Lu Tang invigorates the blood, opens blockages, including fallopian tube blockages due to PID. And here you see the Sanlang, the Eizhu, the Lu Tang is very powerful also for this presentation. And Lu Tang treats pain of the lower back due to Qi and blood stagnation. Also, we can see Chishao doing that. There's a lot happening here. Ganchao is added to harmonize the formula. And there we have a nice modified version of Zhuhuan to treat chronic PID. Let's take a look at another formula used in the treatment of chronic PID. It's a modified version of Tao Hung Suwu Tang. It's a little unusual because it has an ingredient that is used less in the clinic. But this ingredient does eliminate blood stasis and stop bleeding and spell toxicity. And that ingredient is Wu Lingzhi. So you can use that or maybe replace it with another similar herb of similar function if that's something that might not work for you in the clinic, using the flying squirrel feces, or we call the flying squirrel sand. So look for a pulse that is thready. Could be thin is another word for thready, wiry or choppy. The tongue is pale or purple. And we're looking for, in this particular presentation of Tao Hung Suwu Tang, blood stasis and deficiency with heat in the blood. So it does have some tonic properties, but it's been changed quite a bit. Look for indications for this formula: constant, dull, or sharp pain in the pelvic region. So constant pain. Yellow or white belt leukorrhea. Scarring or even masses in the pelvic region. So we're going to be breaking things up. Irregular menstruation characterized by dark purple clots. So there's our stagnation. Antedated dysmenorrhea. Again, that's cramping or pain prior to menstruation. And there may be prolonged menstrual bleeding. But again, constant or dull pain or sharp pain in the pelvic region is one of our key indicators. So Dao Ren and Hong Hua, of course, from Tao Hung Suwu Tang, along with Dan Gui and Chuan Sheng. Also, Dao Ren, 6 grams, Hong Hua, go up to 6 grams. It can be a lot. Dan Gui, 9, Chuan Sheng, 6, and Qishao, 9. Then Shengdi Huang, 12 grams. Wu Lingzhi, 6 grams. Shangfu, 6 grams. And Huangbai, 6 grams. Really a great formula and accomplishes a lot to move the blood and also clear damp heat and help this situation of chronic, dull, or sharp pain in the pelvic region. Again, 1 bag per day. It's decocted 3 to 1 in water. And if there is increased cramping and pain prior to menstruation with purple clots, maybe a stronger function is needed to address abdominal masses, add Sanlang and Eizhu. So for Sanlang, 6 grams, Eizhu, 6 grams, and also Yanhu So. So moving the blood also, very strongly relieves pain, 9 grams. So if there's heat in the blood, we have things like Qishao, but if there's less heat in the blood, and we want to go for more of a tonic property, there's more deficiency, maybe blood deficiency, replace the Qishao with Baishao, and replace the Shengdi Huang with Shudi Huang. If you want to go in between, you can go half and half. Shengdi, Shudi, which is not uncommon. So an increase of heat in the blood may present with a red tongue, a rapid pulse, and generally excessive uterine bleeding or excessive blood loss during the periods with a dark red flow, restlessness, a general feeling of heat in the body, thirst, dry mouth, even skin diseases with red eruptions and itching. So if this happens and there's a greater prevalence of heat in the blood, add Mudampi, 6 grams, and Jutsu, 6 grams. So to really cool things down. And Jutsu, being able to get the damp heat out of all 3 burners, is very effective for the treatment of chronic PID. So there's a nice formula, a modified Tao Hung Suwu Tang, that goes after blood stasis and deficiency also, and heat in the blood simultaneously, and treating constant, dull, or even sharp pain of the pelvic region. One thing we didn't get to is deep deficiency, and this is from chronic PID. So modified Yogui-1 is helpful in the treatment of chronic PID when there is a diagnosis of spleen Qi deficiency and kidney Yang deficiency as the primary diagnosis. So here there's dull pain of the lower abdomen. There's lower back pain, white belt leukorrhea, fatigue, a feeling of cold in the body, a cold sensation in the uterus region, poor appetite, loose stools, irregular menstruation, menstrual pain that worsens after the menstrual flow, so the body's getting exhausted after the flow. So a lot of cold and deficiency signs here. The treatment principle is to tonify the spleen Qi, tonify kidney Yang, and resolve dampness. So the dosage, again, 1 bag per day, and decoct 3:1 in water. Of course, you can get a nice, you can order from your herbal supplier a customized 5:1 concentrated powder, or have custom capsules made, things like that. So this formula contains shan yao, 9 grams, du zhang, 9 grams, lu jiao, 6 grams. So really going for the yang. Shu di huang, 9 grams. Tu si zi, 6 grams. So tu si zi, actually very important herb here in treating gynecological issues, especially from deficiency. Mudanpi, 6 grams. Fu ling, 9 grams, going after the dampness, helping to tonify a little. Shu duan, 9 grams. Shang fu, 6 grams. We see that a lot, shang fu. Helps to really move the qi. And gan chao, about 4.5 grams. If there is profuse white belt vaginal discharge, add 9 grams of qian shi and add 9 grams of jin ying zi. For abdominal masses, again, add sanling and a zhu to break the blood. So 6 grams each sanling and a zhu. So Yogui-1 in its original presentation includes the following herbs: fu zi, ru gui, shan zhuyu, also known as shan yurao, go qi zi, dan gui, shan yao, du zhang, lu jiao jiao, and shu di huang. Also tu si zi. This modified version restores the bodily constitution that has been exhausted due to chronic PID. In this presentation, shan yao, du zhang, lu jiao jiao, here we're using lu jiao, shu di huang, and tu si zi are maintained from the original Yogui-1 formula to tonify kidney yang, benefit the spleen Qi, and nourish the blood. We've added fu ling, we've added mudanpi, and there are similar components of other formulas, but here we are putting them in to help move the blood and resolve dampness and support the body. Fu ling benefits spleen Qi and drains dampness, while mudanpi enters the liver and kidney channels. Mudanpi disperses blood stasis and cools the blood. Shu duan tonifies the liver and kidneys strongly and stops uterine bleeding and treats lower back pain. So a great choice from deficiency, shu duan. Shang fu is added for its ability to regulate qi, treat irregular menstruation, and relieve menstrual pain. And gan chao tonifies qi and harmonizes the formula. So, you know, a modified version of Yogui-1 really getting after that spleen Qi deficiency and kidney Yang deficiency. You know, a chronic infection like this, in and of itself, regardless of other things happening with the patient, can deplete them quite a bit. So this formula can come in handy and really bring them to the next level of health. Long Dan Xie Gan Tang, a great formula for clearing liver and GB damp heat and for acute PID. But we can mix that with Jinling Zisan and create a modified version of the two to treat chronic PID. So look for a thready or thin pulse with this formula, maybe a slippery pulse, and a red tongue with greasy yellow coat. The diagnosis is damp heat in the liver and gallbladder meridians, blood stasis, heat stasis in the Dai meridian. So Dai Mai, we've talked about that a lot earlier, especially in relation to the acupuncture points. And when there is leukorrhea, for example, there is always disorder of Dai Mai, of the belt vessel. So this modification of Long Dan Xie Gan Tang and Jinling Zisan treats heat and stasis in the belt meridian. Look for indications like lower abdominal pain, lower abdominal distension, profuse yellow or red belt leukorrhea. So the yellowish, greenish color for the yellow belt leukorrhea, or the reddish, brownish discharge for the blood in red belt leukorrhea. Also, there may be a foul odor, which is indication that it's infectious. Also, vertex or temporal headache. Pelvic masses may be present, so a palpable lump or maybe revealed by ultrasound or other objective testing for this presentation of chronic PID. So interesting that we're adding a formula that can be used for acute PID into this and modifying it here. So the treatment principle is to clear damp heat from the lower burner, move the blood, and walk or regulate the Qi. Dosage, again, 1 bag per day, ratio 3:1 in water. So the ingredients: Long Dan Chao 6 grams, Huang Qin 6 grams, Zhizi 6 grams, Sheng Di Huang 9 grams. So a lot of clearing here. And then Dang Gui 9 grams, Chai Hu 6 grams, Gan Chao 4.5 grams, Chuan Lian Zi 6 grams, Yan Hu So 6 grams, Dan Shen 9 grams for moving the blood, Bie Jia, so another turtle, 9 grams, and Zhao Jiao Ci 9 grams. So Yan Hu So and Chuan Lian Zi, which are, their own formula together, Jinling Zisan. Chuan Lian Zi is actually alternately known as Jinling Zi. So together, Yan Hu So and Chuan Lian Zi form Jinling Zisan, the golden bell seed powder. And it treats liver qi stagnation and fire in liver channel pain. And we've added it to Long Dan Xie Gan Tang with modifications. And this formula combination strongly clears damp heat while protecting the yin. Zixie, Chechanzi, and Mutang are removed from Long Dan Xie Gan Tang to prevent depletion of the patient's overall constitution. Really, Long Dan Chao is already something that we don't want to overdo it and hurt the qi. We see that it's only 6 grams of Long Dan Chao in this formula. Bie Jia is added to nourish and protect the yin. Again, if you do not want to use a turtle product, find another herbal medicine that nourishes and protects yins and also dissipates masses in the lower burner from blood stasis, because Bie Jia has that function to dissolve masses. Danshen is added to the formula to treat abdominal pain and masses due to blood stasis. And at the same time, it protects and nourishes the blood. So Danshen has a nice moving property inside the blood. Zhao Jiao Ci eliminates toxicity. Zhao Jiao Ci drains the pus and activates blood circulation. It reduces swelling and is recognized as an important herb for the treatment of obstructions and adhesions related to PID. So once again, Zhao Jiao Ci comes up. When we talk about the belt channel, you'll notice that Chai Hu is in there. Now, Chai Hu does help things rise, but Chai Hu is also something that regulates the rising and falling of qi in the body. So again, this is similar to the function of the belt channel, which also controls the upward and downward movement of qi in the body, also the movement left and right, because it is a horizontal vessel, unlike the other major meridians of the body, which run from the head to the toe or from the toe to the head. So this is a great formula, and again, this modified version of Long Dan Xie Gan Tang with Jinling Zi San is a great formula. There can be a lot of red and yellow belt leukorrhea, vertex or temporal headache, palpable masses, lower abdominal pain. So this is a great formula to go after this presentation of chronic PID. One simple herbal formula, and we can add this combination to many formulas, is used to nourish the yin and tendons and to stop pain. So chronic PID, when there's abdominal pain accompanied by diarrhea, when the liver and spleen are not harmonized, use Xiao Yao Gan Chao Tang, so Bai Xiao and Zhi Gan Chao. So Bai Xiao 12 grams, Zhi Gan Chao 12 grams, or add this combination into a formula. Again, this formula nourishes yin and tendons, it stops pain, harmonizes the liver and spleen, and is therefore used for abdominal pain due to liver qi attacking the spleen and stomach. This formula is also used for the liver yin and blood not nourishing the tendons, and therefore is used for pain of the four limbs. So again, for chronic PID, this combination is used for treating abdominal pain accompanied by diarrhea, especially when there's liver and spleen not harmonized. And another common one we see in the clinic, maybe a favorite of Chinese medicine perhaps, and a favorite in the gynecology clinic, is Danje Xiaoyao Wan, Danje Xiaoyao San. So we also call that Jia Wei Xiaoyao San. Perhaps one of the most popular formulas. So Chai Hu 9 grams, Bai Xiao 9 grams, Zhi Gan Chao 6 grams, Dang Gui 9 grams, Bai Zhu 9 grams, Fu Ling 12 grams, Bo He 6, and Shenjiang, fresh ginger, 2 slices. So this formula tonifies the blood, regulates the menses, harmonizes the liver and spleen, and clears heat. It is used for liver Qi stagnation, blood deficiency, and spleen deficiency when there are heat signs. Indications for use with chronic PID include lower abdominal pain, shortened or irregular menstrual cycle, increased menstrual flow, abnormal uterine bleeding, and a menstrual flow with a fresh red color. Other indications include Xiaoyang-related disorders such as headache, dizziness, dry mouth, dry throat, blurry vision, costal region pain, alternating chills, and fever. Other indications may be irritability, redness of the eyes, night sweating, tidal fever, fatigue. What's interesting here is there's such easy minor modifications to this formula that can be made to make it just a little more appropriate for PID, because we want to get rid of damp heat, we want to get rid of blood stagnation. So maybe Bai Xiao can be replaced with Qi Xiao, especially if it's a little warmer, the condition is a little more damp heat or heat. Or you could have Bai Xiao and Qi Xiao in the formula together. So you could swap out one for the other or combine them. Dangui, we can easily use Dangui Wei, the Dangui tail, which is more for invigorating blood, for example. So there's just subtle ways we can tweak this formula to give it more of a blood invigorating property. Or we can add Baijiang Chao, we can add Lulu Tongue, we can add Hung Tongue, and then really customize this to clear heat and toxins and move the blood with a few simple modifications. So again, Danje Xiaoyao Wan, it's so easy to make work for the treatment of PID with just a few tweaks here or there. Absolutely important and fantastic formula. I want to look at a special series of formulas now that are a little less common, and they're really each one is a blueprint for an approach to different types of PID. This comes from the Xiaoyang Feng series, and it's the Make Disappear Itching Formula series. these were strongly recommended by Professor Sharon Fung during her lifetime in the treatment of several types of PID and even other disorders in the gynecology clinic. The itching here referred in the name of the series refers to the fact that a light infection can actually cause itching, and a more serious infection then can cause pain. So this is the Make Disappear Itching Formula series. General principles overall here are to clear heat and eliminate toxins, regulate Qi, expel dampness, warm the channels, transform phlegm, and expel stagnation. So the preparation is 3-to-1 and decoction and 1 cup per day. So let's look at Xiaoyang formula number 1, and this is for damp heat PID. So Chai Hu, 9 grams, Huang Qin, 9 grams, Chishao, 9 grams, Yi Ren, 12 grams, Baijiang Chao, 18 grams, Chuan Lianzi, 9 grams, and Chen Pi, 6 grams. So we see a lot happening here. We see Chai Hu regulating the Qi with its cooling properties, Huang Qi for the damp heat, Chishao, again, cooling the blood, dissolving blood stagnation in the uterus and abdomen, Yi Ren to drain dampness, Baijiang Chao, again, going after clearing heat and the toxins and moving the blood. Exactly what we want in PID. Chuan Lianzi to regulate that Qi, and Chen Pi help really make this a digestible formula and to walk the Qi and also address the issues of dampness. So this is a great compact formula and a template that can be modified for the treatment of damp heat PID. Now another formula in this series is for cold stagnation PID. So this Xiaoyang Feng formula is comprised of Dangui, 12 grams, Bai Xiao, 6 grams, Chishao appears again. Again, one of our heroes of the story is Chishao, 12 grams. So useful in a lot of situations. Ru Shang, 3 grams. So strongly moving the blood. Rugui, warming, 3 grams. And Shangfu, 6 grams, gently warming and circulating. So this is a great combination for cold stagnation PID. Again, we're moving the blood here, but we're also warming the channels and circulating and even tonifying a little bit. So a great formula for chronic PID with cold stagnation. And again, cold stagnation here primarily refers to cold stagnation in the liver channel. We can also say through the belt channel. We can say in the penetrating channel. So let's take a look at another one of the Xiaoyang formula series. Now, this one we'll say is for dampness or for phlegm congestion. So a quick look at that shows us that there's a lot we can do here. It's a little different than what we've seen before. There'll be some familiar herbs and some different ones that we're going to use for PID. So Kangju, 9 grams. And Kangju, again, has a very strong property to go after dampness. Fuling also, 12 grams. Chao Do Ko, 6 grams. Ban Sha, 9 grams. Very strongly dissolving phlegm, but going after dampness. Shangfu, again, 6 grams. Dan Chen, moving the blood, 12 grams. And Chishao, once again, 9 grams. We see Chishao over and over again. So this form of PID always includes leukorrhea as an indication. So this is a great formula for the treatment of leukorrhea and PID together. And another formula in our series is fallopian tube blockage, just straight, which is, again, very common. We've seen a few formulas, both acute and chronic, for the treatment of fallopian tube blockages. Here we have Danshen, 15 grams to move the blood. Chishao, 9 grams. Shangfu, 6 grams. Kangju, 6 grams. Pu Huang is added, 6 grams. And Wu Lingzhi, again, makes its appearance at 9 grams. So There may be lumps or pain in the fallopian tube region. They can be palpable. That may tip us off to the fallopian tube blockage. And this combination is yet another template to work from. We see a lot of familiarities between the formulas for the treatment of fallopian tube blockages. So taking a look at these formulas, any one of these formulas, you can make some modifications. For example, if there's damp heat, add Pu Gong Ying 15 grams, so to clear heat and toxins. And Bai Zheng Chao and Hung Tung also are great additions for damp heat and heat and toxins. Bai Zheng Chao and Hung Tung. Once again, other heroes of the story along with Xiao appearing over and over again. These two herbs being clearing heat and toxin properties, but also moving the blood. For spleen Qi deficiency, add or increase Bai Zhu. So we want to tonify a little there and dry dampness. And Dangshen, so tonify Qi, and Fu Ling. So again, for dampness and a little bit helping the spleen there and water circulation through the body. And also with kidney Qi deficiency at Shu Duan and Go Ji. So Go Ji and Shu Duan for kidney Qi deficiency in those formulas. And so that's part of the Xiaoyang Feng series. There's more in that series, but that's a great basis of 4 formulas and some modifications that are very, very helpful in the treatment of chronic PID. Cervical infection, cervicitis, inflammation of the cervix, and cervical dysplasia even fall into this category, especially cervical infections and cervicitis. Cervical dysplasia is not necessarily associated with PID, but can be. So in all 3 of these instances, damp heat in the lower burner, excess heat and toxins, and spleen and kidney Qi deficiency and dampness may be involved. For all 3 of these, cervical infection, cervicitis, and cervical dysplasia, they can be completely asymptomatic, which is very problematic. White, red, and yellow belt leukorrhea, typically gray or yellow color, and are often pronounced immediately following the menstrual period, is indicative. Vaginal bleeding, especially between menstrual periods or post-menopausal bleeding, and especially after following sexual intercourse, that's definitely a potential cervical infection or cervicitis. Painful intercourse, vaginal itching, irritation of the external genitals, burning or frequent urination, lower back pain, abdominal pain, even infertility can result. In severe cases, fever and nausea. So let's take a look at cervicitis. That's just general for all 3. Symptomatically, cervicitis, inflammation of the cervix, is often differentiated from other forms of PID by bleeding after sexual intercourse. Unlike vaginal infections, which are typically uncomfortable, a cervical infection may not itch at all. Cervical infection, cervicitis, and cervical dysplasia all can be completely asymptomatic. Therefore, it is strongly recommended that women have a pap smear. Some say at least once per year, even more than once per year if there is a history of chronic vaginal discharge. A cervical infection may cause inflammation of the cervix, cervicitis, and it potentially can lead to cervical dysplasia. So we do want to resolve this condition as quickly as possible. Most cases of cervicitis are caused by an infection, but cervicitis is not necessarily caused by an infection. Chlamydia, gonorrhea, trichomonas, that's parasites, they're all 3 common sexually transmitted diseases contributing to cervicitis. Other organisms such as herpes simplex, streptococcus, staphylococcus, enterococcus, there's many, may lead to cervicitis. Other contributing factors may be reaction to chemicals in douches and contraceptives and tampons, allergic reactions to latex condoms, even physical injury can lead to cervicitis. Cervical dysplasia, that's different. That's labeled precancer, and it has not yet advanced to the cancer stage. It's abnormal growth of the cells lining the cervix. Mild dysplasia is the most common type, and the cervical tissue returns to normal without treatment in the majority of reported cases. If untreated, and in some cases even when treated, cervical dysplasia may advance to cervical cancer. Risk factors include multiple sexual partners, HPV, the human papillomavirus infection, HIV, tobacco smoking, poor nutrition, the use of oral contraceptives may contribute to this. Also, the daughters of women who took DES, it was a chemical more prevalent in the 60s, given to pregnant women. It's a synthetic estrogen. They're at risk also. So cervical dysplasia may be asymptomatic, and again, pap smear once a year or even more than once a year may be very important. Routine visits to a gynecologist for early detection may help and prevent and help screen for cervical cancer. So early detection is paramount in these cases. So let's take a look at a nice formula for cervical infection, cervicitis, and cervical dysplasia. This is a whole topic unto itself, but let's look at a modified Yihuang tongue. Here the pulse is slippery and rapid. The tongue is red with a yellow coating. I definitely want to take a look at least this formula. So the diagnosis is damp heat in the lower burner with spleen Qi deficiency. There's yellow belt leukorrhea, which is a yellow color, foul odor, lower abdominal pain, low back pain, infertility, dysmenorrhea, cervical erosion. So communication with the gynecologist may be very important. Vaginal bleeding following sexual intercourse. So that's the tip-off right there. The infectious state. Treatment principle: clear damp heat, drain the dampness, strengthen the spleen, and stop leukorrhea. So we have a tonic property here with Shan Yao, 9 grams, Qian Shi, 9 grams, astringent, Huang Bai, 6 grams, Chechanzi, 6 grams, Bai Guo, or also called Yingxing, 6 grams, Zca, 6 grams, Chengyan Pi, 6 grams, Mudan P, 6 grams, and Baijiang Chao, 9 grams. Great formula. Has those astringent properties, a light tonic property, drains the dampness, clears the heat and toxins. If there's red belt leukorrhea, add San Qi 6 grams and DU, add 9 grams of DU. So the dosage here is 1 bag per day, and again 3 to 1 in water. So that's just a great formula and is very useful in this situation. Okay. Well, hopefully that was helpful in uncovering a lot of aspects of pelvic inflammatory disorder. Part of our series, we've had many courses on this. Look forward to more. We'll also be featuring many anytime courses on pelvic inflammatory disorder. We have a few up already. Some you can view in a downloadable ebook, and we have our video anytime courses as well. So there's a lot in healthcmi.com that can help in this treatment of this disorder and many other disorders that we cover, both with herbal medicine, acupuncture, safety and ethics issues, also dietetics. So we do a lot of webinars on dietetics. Don't forget that afterwards you can go online to www.healthcmi.com. You can take a quiz and get a certificate of completion. So, you can do that right away. And I want to thank everyone for coming and enjoyed doing this very important presentation that is so vitally important to our patients to help them in their medical well-being. This can be a very serious problem for people. People can suffer quite a bit. Again, what is at stake? There's 750,000 1,000 women per year who get PID. 150 women die every year. Also, it's endemic, and largely it's underdiagnosed, and in many cases, women are given multiple series of antibiotics, but they're not working, and also multiple exploratory surgical procedures in an attempt to control it and remove infected and eroded tissue. So this is something in the Chinese medicine clinic. We have so many wonderful herbs to help us. In acupuncture, we covered things like Baijiang Chow and Chungenpi and Lu Tang. So many things that we have that are specific for invigorating the blood and clearing the heat and toxins and clearing the damp heat. So these are incredible herbs for us. Qi was another favorite of the day for the treatment of PID. Again, I want to thank everyone for coming. And again, if you log in with your username and password at any time, you can take the quiz. You can take it again if you need to, receive your certificate of completion there right online. And of course, you can email us if you have any questions by hitting the contact button. And again, thank you very much for coming. Look forward to more courses. We feature many courses with Professor Liao and Professor Peng, to name a few. Up-and-coming courses will be live webinars and anytime courses in Chinese medicine dietetics, which is always a lot of fun. We have covered in the past cooking with jellyfish, for example, which is actually an appropriate food for people with PID because jellyfish, which, by the way, we never saute, ruins the function. Just clean by boiling lightly for a few minutes before dressing with something to flavor it. Jellyfish dissolve nodules under the skin, but it clears heat and toxins strongly. So not only for something like acne and nodules under the skin, but again, an appropriate heat clearing and dissolving phlegm food in the treatment of any type of disease where there's damp heat congestion. And if there's any more questions, again, after the webinar, feel free to just hit the contact button and at www.healthcmi.com. Anytime you like, again, log in with your username and password, and then we can get you your certificate of completion right away. There was a question that came up about actinomycosis. That bacteria can be caused by an IUD, whether the copper or progesterone type. It's normally in the nose, it's in the throat, in the mouth, so it may be associated with dental issues, but it's normally a safe bacteria count, but it can get out of control there, but it can also lodge in the lower burner through the use of IUDs. And another question that came up when people take the webinars in general and today, parasitic worms, that's schistosomiasis. Again, that's more in third world nations that are poor developing nations where there's poor access to clean water. So that was that. And sarcoidosis, which is another cause of PID. That's a very unusual disorder with nodules and clusters, granulomas. They're clusters of tissue that form as a result of this deficiency syndrome with excess damp stagnation. So very unusual disorder, very compromised immune system, but Chinese medicine can not only treat PID caused by sarcoidosis, but can also help in this condition tremendously, so strongly recommended for that. I want to thank everyone for coming. I look forward to seeing you again, and we'll see you soon. The Healthcare Medicine Institute, www.healthcmi.com. I'm Adam White, licensed acupuncturist. I'll see you soon.